Let's take a quick look over here and see what we have. This Dr. Vafaie here send me a long text, a lot of video clips. Take a look and see what he has. Well done.
Hi guys, I'm headed for my first root canal. I'm excited. I'm a root canal specialist. My name is Dr. Vafaie, and I practice in the San Francisco Bay Area. And I cracked my tooth about 6 months ago, and I can't chew anything on it. It hurts when I chew potato chips or pita chips, anything hard, and it's annoying. I got a crown with my dentist, and that didn't really do much. It may have made it worse a little bit. I have a little bit of cold sensitivity going on. It's my upper last tooth. So I'm headed to see my buddy Dr. James Ho in Berkeley, California. And he was kind enough to offer to do a root canal for me. And I really like his work, and I think highly of him. So I'm gonna go see him. And I'm gonna share my experience with you guys so you kind of know what's in store, okay?
What's up?
All right, guys, so I'm in Dr. Ho's dental office here in Berkeley, California.
Hey.
And they're about to test me out. As I said, I'm having biting pain. It's been going on probably about a few months. The crown made no difference. If anything, it made it worse. There's my x-ray. And stay tuned. I'll let you know how it goes.
Hey, cancel the anesthetic. We ran out.
Uh-oh, they're canceling anesthetic.
Okay.
Painless.
Good. A few drops there.
Painless, palatal. That's usually like quite a painless shot, but
Painful shot.
or I mean painful shot, but Dr. Ho, good technique. All right, guys, we're about to start. Dr. Ho's going to put the dental dam on. He's got the microscope in place, and we're going to get going.
I'm going to close the whole thing. Yep. Fill your mouth here, up a little bit, and rest your jaw there. But before that, let's get some irrigation in. No way, just like that, bro.
All right, guys, all done. Took about, an hour and change. Not too bad. Very smooth. We found all 4 of my canals, which is great. That's why I chose to see a specialist who uses a microscope. And Dr. Ho, as you see in the video, used the scope to find all the canals for me. And his wonderful assistant here did a great job. And everything went well. So here we have my tooth before. And you can see the roots here and the crown, and there's the nerve space. In my case, I didn't have a lot of infection here around the bone, but some patients do. And that's where the filling came in. And Dr. Ho was really awesome in finding all 4 canals. You can see 1, 2, third one, and the 4th. He was able to get the filling all the way down to the very tip of the root, which is what we want to see in root canals. And then there is the final filling. You can see it's sealed. He did a really nice small access here. All the canals were sealed. This is a little sealer, which is pretty common in root canals, and it tells us that we got all the way down to where we need to, and turned out real nice.
Well, here we go. As you can see, this is one of our own RWE faculty, Dr. Vafaie, is an excellent endodontist up in San Francisco area, who apparently ended up needing a root canal. So I wanted to, he sent me these videos, and I figured I'll share it with you and give him a call now and check out, how his procedure went and what it felt like. And by the way, here's my brother's little dog, Charlie, who's making a special appearance in today's video. All right, let's give a call to Dr. Vafaie and see what's he up to. All right, look who do we have here, Dr. Nasseh Vafaie, our own, RWE faculty and a great endodontist out in San Francisco. Nasseh, thanks for taking my call. I know you're in the middle of practice right now.
I am.
Yeah, terrific. So, you send me these video clips that I thought were really cool and interesting. I was cringing at times. We were getting the shots, but at the same time, you had Dr. James Ho, who's a great endodontist, work on you. So that went perfectly well. Tell me off the bat, how does it feel to taste a little bit of your own medicine?
It was humbling. It was, I have to say, I was a little apprehensive going into my second root canal. Actually, Dr. Nasseh, you did my first root canal when we were at Harvard together like 20 years ago.
1994, my friend.
1994. And how technology's changed, I got to say. But it was, it was quite a nice experience. I had a little bit of apprehension going into the procedure. Excuse me 1 second. I just need to speak to my assistant. Norco, please. Thanks so much.
Multitasking, I see. Okay.
Multitasking. Sorry about that.
No
and
problem.
anyway, so I had a root canal done on tooth number 15. Bit on a piece of rock that was in my food, and I knew right away that I fractured the tooth. I gave it several months to see if it would improve. I got a crown, and the crown didn't really
as you
help.
said in the video, so you basically felt that it was kind of irreversible pulpitis, and that's why you decided you're going to have the endo even after the crown.
Yes.
But besides the technical aspects of it, because you already know it, I know it. James obviously is a great clinician. You guys got a great root canal. We saw the results. It was wonderful. I really enjoyed it. I mean, using the microscope obviously is a key thing, along with the skills that James has to find all the 4 canals. But I'm more interested in finding out, what do you think? How do you think this experience changes or makes you a better endodontist, having a root canal yourself and going through the experience yourself?
It's just having a patient perspective every once in a while. I recommend for every practitioner.
To have a root canal every once in a while?
Have a root canal every once in a while. I definitely recommend it, or some level of dental work. Just even receiving the anesthesia, or how it feels to have a bite pillow in, how it feels to have a rubber dam placed on you for about an hour and change, and all those things kind of culminate to have you be a better practitioner. I think one of the things I learned, for example, with a bite pillow while I was biting on it, which we use for every patient, but I've since learned to tell patients to kind of go ahead and relax on the pillow rather than actually bite into it, so the joint doesn't get too tired and the muscles don't get too stiff. But it's a long time sitting under a chair for an hour, and so watching Dr. Poland is
an argument. That's an argument, Dr. V, for efficiency as well, right? I mean, ultimately, if we're working on extracted teeth, it's one thing, but working on human beings where we have these limitations, that's a key thing. And that goes into having also multiple appointments, whether a patient can open up long enough if it takes a long time to do it in one visit.
Yeah,
so those are all important factors, right?
Yeah.
But again, let's taking it. So you think that as a result of this experience, and you're a better endodontist, and I'm sure you already were a great endodontist, but this is, I'm sure, is going to change you and give it a little bit of sympathy and empathy into the factor. One of the things I do, Nader, is that during every now and then, I want to sit in the chair myself in that same exact position, bring the scope over my head, just look around. Oftentimes, just from the perspective of hygiene and cleanliness, we don't realize the perspective of the patient. Sometimes there's something in the light that we don't see, something, around the scope, a little something that just grabs their attention. It's one of those things that it's sometimes an interesting thing to do.
Yeah,
now,
can I say one thing, Dr. Nasseh? One of the things I did notice is everything is so bright. The dental lights are bright, the microscope lights are bright, and one of the things I appreciated about Dr. Ho is that he used dark shaded sunglasses, and that helped.
Yeah.
And, for patients that are a little bit claustrophobic, when you have this big scope over you and you've got the rubber dam on, I'm not really claustrophobic, but I did feel kind of a sense of anxiety when everything was above me and the door was shut in the operatory. It is kind of an unnerving feeling a little bit to be in that vulnerable position at the mercy of your great practitioner. And so, it gives you a whole sense of appreciation of what we do, and when we do it day in and day out, for the most part, it's humbling and rewarding at the same time.
Absolutely. I mean, that's the definition of an expert, somebody who makes it look easy, right? But the nuances is what makes the difference. Now, what I found to be interesting is, besides the fact that James was great in giving you shots that were completely painless, both buccally and palatally, the experience itself was completely painless. Did you have any post-op discomfort afterwards?
I had probably, on a scale of 1 to 10, probably about a 3, which I attribute to the PDL pain after root canal. But the biting pain pretty quickly went away. And in my case, Dr. Ho didn't really see a fracture in my tooth. So we're still at wonder as to why I was having the biting pain with my tooth. So
usually most of the discomfort afterwards is kind of peaks after a day or two. By the third day, it starts to go down, kind of like swelling and surgery. Is that kind of what your experience was as well?
Yeah, pretty much. I took a little bit of Motrin an hour before, and the night of, I really didn't take any medication, and by the next day, it was pretty much feeling normal.
Perfect. That's awesome. I mean, that's great length control and management, as well as good technique, obviously. But let me ask you a question that is obviously on the political side, in terms of how long do you expect this root canal to last? Because if you speak to an implantologist, they'll tell you this is in a pre-implant phase. But obviously, we know that root canals last a long time, correct? So how do you, first, I want to ask you two questions. What do you think, how long do you expect this tooth to last in your mouth? And secondly, what factors would make it fail?
I think, obviously if it's fractured, it's going to throw the prognosis down a little bit. Fortunately, we didn't see one. Doesn't mean there isn't one in the tooth, but at least with the scope, he wasn't able to visualize it. So that could throw the prognosis down a little bit. Parafunctional habits on a tooth that may be fractured could obviously throw the prognosis down a little bit. I don't plan to change my chewing habits much on the tooth, and I think the whole movement of dentin conservation and the way we do root canals, minimal preparation, et cetera, and hopefully we'll fly with the tooth for a long time.
No, of course. I mean, look, the other one that we did, that I did for you back in '94, still in there, right?
Yeah.
Or is that an implant now? No,
it's a tooth.
That's terrific. So, it can last a lifetime. The thing that we don't oftentimes discuss with the patient is their own role in keeping the tooth and maintaining it by having proper oral hygiene, keeping things clean, the restorations, the margin of the restorations, obviously always the weak link. Keeping that area clean goes a long way in terms of extending the lifespan of the tooth, doing flossing and then the brushing, as well as, discussing these parafunctional habits with patients that have them, to make sure that not only they get a night guard, but they wear it, and they really understand what their role is in terms of keeping their tooth and expanding the lifespan. So, Nader, I know you're at work. Just wanted to quickly chat with you, get back to work, and do some of your great works. And thanks to Dr. James Ho for the great job that he did on you.
I'm very grateful to Dr. Ho, and to be able to share this experience with you, Dr. Nasseh. And
that's terrific.
Yeah.
Well, Thanks so much again for joining me. All right.
Of course.
We'll see you soon. Thank you.
Bye-bye.
All right, so I guess what we learned today is that all of us as practitioners are also humans, and we end up needing all kinds of procedures. And this is at these times where we get to probably most relate and empathize with our patients, because we realize that it's not so much that technical part that we're all been taught in school to perfect and do the right techniques and procedures and the protocols and the x-rays and all that stuff. And it's the human element of taking care of our patients, relating to them, connecting with them, and making sure that we don't just treat the x-ray, but we treat the individual. So at the end of the day, when they leave our care, they have had a wonderful and positive experience beyond what we have provided to them as a technical service. For real, then no, Nasseh, now let's save some teeth. Great job, Trevor. Great job, Ben. Oh, so cute. All right, go chase some squirrels.